It includes emphysema and chronic bronchitis. A COPD exacerbation is a sudden worsening beyond the patient's usual daily symptoms. Seek immediate medical care for severe difficulty breathing, persistent chest pain, or blue lips. Do not wait if there is confusion, severe weakness, or a rescue inhaler that is not working. In summary, bronchitis is usually a post-viral cough. Pneumonia is a serious lung tissue infection. Asthma is episodic narrowing. COPD exacerbation is a flare-up. The key question is this person breathing safely?